It is a pleasure to have the opportunity to introduce our distinguished guest speaker, Dr. Deema Abdul Hadi. Dr. Abdul Hadi is a family doctor based in Ontario, Canada. She's a graduate of the Royal College of Surgeons in Ireland and completed her family medicine residency at University of Toronto, where she was a chief resident at Mount Sinai Hospital. She's a fellow of the College of Family Physicians of Canada. Dr. Hadi Abdul Hadi is a lecturer with the Department of Family and Community Medicine at the University of Toronto. She has held several leadership positions with the University of Trillium Health Partner Hospital and Primary Care Network in Mississauga, Ontario. Today, Dr. Abdul Hadi will speak about the role of primary care in early detection of breast cancer. Welcome, Dr. Deema Abdul Hadi.
Thank you, Hanan, and thank you to the organizers for having me here today. It's a pleasure to be here, and welcome to the first annual Multidisciplinary International Breast Cancer Conference. So today my talk will be about the role of primary care in early detection of breast cancer. Hanan so kindly did my introduction. I will just add one thing, that I was a Cancer Care Network representative for the Mississauga-Halton Local Health Network for several years, and there is no disclosures that I need to have associated with this talk. So today I want to talk about the various roles of primary care in breast cancer diagnosis. I'll touch a little bit about screening, and we'll also just quickly review education regarding symptom recognition for patients. So why are we having this talk? Why are we having this conference? So breast cancer is significant worldwide. The incidence is approximately in 2020 thought to be over 2.3 million women were diagnosed globally and over 685,000 deaths. That's a lot of people. 1 in 8 women will be diagnosed with breast cancer in her lifetime, and the majority of these, over 80%, will be over 50 years of age. It's thought to be that less than 1% of breast cancer diagnosis will be in men. Specifically, the incidence of breast cancer has been increasing in Palestine over several years. This can be attributed to several factors, including increased awareness, therefore increased screening and increased detection and diagnosis. It also can be attributed to lifestyle factors such as dietary habits and poverty. It is the most prevalent cancer in Palestine and Canada in women. Breast cancer accounts for about 32% of total cancer diagnoses in the West Bank and 18% of those in the Gaza Strip. Breast cancer is most treatable when detected early. In 85% of Canadian women diagnosed with breast cancer, in 88%, so close to 90% of women, when they are diagnosed with breast cancer, will survive 5 or more years. Unfortunately, more than 60% of Palestinian breast cancer cases are found at a late stage, and therefore reducing the chance of survival. So how can a primary care practitioner help? Well, primary care physicians play an important role in early cancer detection. A recommendation from a primary care physician, for example, is consistently one of the strongest indicators or predictors of cancer screening uptake, such as mammograms or clinical breast exams. Primary care physicians may also ensure more timely diagnosis after screening abnormalities and prevent diagnostic delay. A retrospective study was done, which included more than 280,000 women with a diagnosis of breast cancer. It was found that primary care physician visits were associated with improved breast cancer outcomes, including greater use of mammography, reduced odds of late-stage diagnosis, and lower breast cancer and overall mortality. So what roles can a primary care physician play? Well, a family doctor may help discuss reduction of modifiable risk factors. They may identify who and when to screen. They may help with education regarding symptoms and informing patients of when to seek care. And they may help with further referrals for diagnostic modalities such as mammogram, and also may help with referrals to specialists for further treatments. So, what does it mean to have primary prevention for breast cancer? There are certain modifiable risk factors that a patient may be educated about in general. Now, obviously, it's not guaranteed that somebody who has certain conditions or certain behaviors will necessarily have breast cancer, but it's a talk that I think is worth having with the patient. For example, if patients are having excessive alcohol intake, the recommendation to reduce that would be helpful. If somebody has an increased BMI and if they're not exercising, the recommendations, of course, to reduce their weight or to increase their activity would be helpful. And if possible, reducing the risk of exogenous hormone exposure, such as estrogen, would also be preventable. Now, of course, there are non-modifiable risk factors, such as simply being a woman, increased age, which I would love to say that we could change. Unfortunately, we're not able to. And then things like the family history and having a genetic predisposition, such as the BRCA gene. Now, it's important to note that just because somebody has a family history doesn't necessarily mean that they will get breast cancer. And somebody who doesn't have a family history is not at a reduced risk of developing breast cancer. And of course, if somebody may have breast cancer, they may do genetic studies, and actually they may not end up having any genes that are associated or known genes that are associated with breast cancer. And of course, if somebody is in their later stages of life and their reproductive status, such as menopause, is an increased risk factor for breast cancer. So one of the important things to remember is that early diagnosis is crucial to reduce the morbidity and mortality associated with breast cancer, and screening will help to catch these patients early. So screening is an assessment done on asymptomatic patients to detect disease. So it's somebody who presents, for example, for another reason, blood pressure, refill of their medications, and you'll be talking to the patient about getting their breast cancer screening. Screening in Ontario, for example, is part of a screening program called the Ontario Breast Screening Program, where eligible women will be routinely called for screening of their breasts. This program differentiates between average and high risk patients and offers different testing and intervals accordingly. Most women will fall into the average risk population, and these women generally will be between 50 to 74 years of age, and they will be screened with mammograms every 2 years. Obviously, if something is detected, they would need to have diagnostic follow-up, additional imaging, potentially biopsy, and then if the cancer diagnosis has been made, they are no longer in the screening protocols and they will move on to the breast cancer assessment units. And if it becomes a benign assessment, benign diagnosis on the screening, they'll continue their screening every 2 years. High risk patients who may fulfill certain criteria to get that high risk status would be screened with mammograms and potentially MRIs, and this would be a yearly assessment, and of course they would follow the same pathway. So as mentioned previously, early detection and intervention is key. A study done in Palestine that showed only 42% of participants demonstrated good awareness of breast cancer symptoms. This can lead to delayed presentation and delayed treatment, and which, as we know, can have worse outcomes associated with it. So more targeted educational interventions are needed to promote Palestinian women's awareness of breast cancer symptoms to facilitate early diagnosis. For myself, anytime a patient has come in for an assessment regarding the breast, I will review these symptoms and I'll do a clinical exam. I will then talk about what are the red flag symptoms to come back. So let's say I've talked to a lady about a normal mammogram screening. They have no symptoms. Everything is good, and they should be followed up in 2 years. I'll talk to them about looking out for breast lumps, axillary lumps. I'll talk to them about if there's any nipple retraction or bloody discharge, any skin changes or skin retraction, or any changes in the breast shape that they should represent to my office. And I'll add the comment that even if your mammogram was done 3 months ago and we gave you the all clear and you have these new symptoms, you need to be coming back to the office. So we've talked about asymptomatic patients, we've talked about symptomatic patients. Well, what else can a family doctor do? So primary care physicians have the added roles in referring for further management. That can mean confirmation of the diagnosis. Let's say a lady comes in with a breast lump and we're concerned, we would order a mammogram, an ultrasound. Depending on the situation, sometimes a breast MRI may be indicated, although that is difficult to get in Ontario and it is not available as a primary care physician to order. That usually is done through either the high-risk program or certain specialists. Family doctors will then refer on to surgical consults where they may do a fine needle aspiration or they may do a biopsy. Here in Ontario, we have something called the Diagnostic Assessment Program, which is a multidisciplinary program. They are referred there, they access patients are referred there, they can access sped up care for getting the assessments done, the biopsies done, and further management. Family doctors also play an important supportive role during the diagnosis time period and treatment time period. There's a lot of emotional aspects associated with being diagnosed with breast cancer. It takes a toll on the patient. It may take a toll on the family, who may also be a patient of the doctor, and helping them, support them navigating the system, understanding what comes next, explaining things that they may not have quite understood during that time period. And finally, once the patient is in remission, family doctors are instrumental in monitoring for reoccurrence after completion of the treatments. So having that yearly checkup with a mammogram and with a breast exam yearly is important. In between those yearly appointments, if any symptoms come up, of course, those need to be investigated. Here in Ontario, this is generally shared with the oncologist. That role is shared with the oncologist. And then after a certain number of years, once the patient has deemed to be in remission, for example, for 5 years, the role then is taken on by the family doctor. So these are some resources that I think will be helpful for education of patients. The first one is from the American Cancer Society. I chose the American Cancer Society information because it was in Arabic. I unfortunately didn't find anything in Arabic from the Canadian Society, although that resource may be out there. The second resource is called My Cancer IQ. It's an interesting calculation where a calculator where patients can go into the website. They can take a look at individual types of cancers and review their individual risks of each of these cancers. So for example, a patient would enter in, choose breast cancer from the different types of cancer they want to take a look at, and they would go through the questions entering in. So what's your age? Are you male or female? Are you, do you have a family history? What age did your period come? What age did menopause start? And once you've entered in all the risk factors that are known, the calculator will give you a risk stratification. That may include an average risk, versus a high risk. If patients are coming with the high risk stratification, that may lead to increased screening and an increased education regarding symptoms to look out for and potentially change management for that patient. Now, it's important to note that I didn't say low risk, I said average risk, because the reality is breast cancer is so common that we need to pay attention to these symptoms. We need to educate women so that they have the best outcomes. Thank you so much for joining me today. I hope you enjoy the rest of the conference and have a great day. Thank you.